medication I'm going to discuss today is chlorodiazepoxide, or Librium. Its chemical class is benzodiazepine, and its therapeutic class is anti-anxiety. The expected pharmacological action is that it decreases activity by reducing overactivity in the central nervous system, and it increases the action of GABA that blocks nerve transmission in the central nervous system by depressing activity in the brainstem and limbic system. Its therapeutic use is that it is used for short-term management of anxiety, and it is used with acute alcohol withdrawal, and it provides perioperative relaxation and reduces apprehension and anxiety. Complications with this medication is common side effects include drowsiness, sedation, nausea, constipation, headache, and dizziness. Adverse side effects in which you would want to call a doctor would be suicidal ideation, hypotension, hepatic dysfunction, jaundice, ataxia, and amnesia. Contraindications or precautions. Contraindications would be hypersensitivity, alcohol intoxication, and suicidal thoughts. Precautions with this medication would be impaired liver function, use of opioids with this medication, depression, COPD, and sleep apnea. Interactions with the other medications while taking this would be other central nervous system depressants, which can have additive effects, resulting in enhanced central nervous system depression. Oral contraceptives, azole antifungals, SSRIs, verapamil, opioids, valproic acid also causes impaired hepatic elimination of benzodiazepines, resulting in enhanced benzodiazepine effects. Rifampin can cause increased benzodiazepine clearance, resulting in reduced therapeutic effects. Theophylline can cause an antagonistic effect, resulting in reduced sedative effects. Phenytoin causes reduced clearance, resulting in benzodiazepine toxicity. Medication administration in children would be in children over 6 with mild anxiety. They often take capsules or tablets and are given 5 milligrams 2 to 4 times daily, and can increase to 10 milligrams given 2 to 3 times daily, or can also be given a half milligram per kilogram daily, divided into equal doses every 6 to 8 hours. In children over 12 with severe anxiety, they can be given an IM injection, and that is measured by a half milligram per kilogram into equal doses every 6 to 8 hours. In adults with mild anxiety, it is also often given with capsules or tablets, prescribed as 5 to 10 milligrams 3 to 4 times daily. And with severe anxiety, capsules or tablets are given with 20 to 25 milligrams 3 to 4 times daily. It can also be given through IV or IM injections in adults, and it is initially given with 50 to 100 milligrams, then 25 to 50 milligrams 3 to 4 times daily as needed, with a max of 300 milligrams daily. Nursing interventions would be that to monitor liver enzymes during therapy, watch patients closely for suicidal ideation, be aware of the potential for severe respiratory depression if a patient has to be on an opioid and this medication. Monitor patients' vitals closely as hypotension and respiratory depression can occur, and to take this medication as instructed. Client education is that patients should not consume alcohol or take an opioid while on this medication. Prolonged use can lead to dependence, and encourage family to watch patients closely for suicidal ideation while on this medication. And teach the patient not to take in acids while on this medication, as it can affect the absorption of the Librium. And the patient should not drive or operate heavy machinery until knowing how this medication will affect them. When evaluating medication effectiveness, you would often see a decreased sense of anxiety, an increased ability to cope, and more rational ideation when used for alcohol withdrawal. The sources I used was the Lilly Pharmacological Textbook and our drug book.